Kentucky Governor Matt Bevin is moving forward with another campaign promise. Today, he held a news conference to discuss the first steps in changing the state's Medicare system. WKYT's Victor Puente shows us what Governor Bevin wants done with the program.
They're calling it a transformative Medicaid program. Today, Governor Matt Bevin announced the creation of a team that will overhaul Kentucky's health care system. The governor said that team will work to come up with a new plan for the way Medicaid is distributed in the state of Kentucky. Under the Affordable Care Act, former Governor Steve Beshear expanded Medicaid to include hundreds of thousands of Kentuckians who were previously uninsured. Bevin says the state can't afford to continue with that plan.
It is to find a solution for us, but one that frankly will serve as a beacon for others as well, because ultimately it's a function of making sure it's sustainable. We are spending the taxpayers' money.
That team will be led by Mark Birdwhistle, the current Vice President of Health Affairs at the University of Kentucky. Bevin said the program would be modeled after a similar program in Indiana. The government there received waivers from the federal government to implement their own plan.
We keep talking about looking at the Indiana model. My personal preference is we need a Kentucky model.
Bevin said concerns by the Beshear administration that people would lose access to health care were an attempt to hide the fact that the state couldn't afford to continue with that process. Beshear released a statement on Facebook saying, quote, Medicaid expansion was and remains a smart policy move. It's the most cost-effective way to get the poorest Kentuckians healthy. He went on to say that the program was paying for itself. Bevin said the new program would create more personal responsibility by requiring recipients to have a financial stake in their health care.
We owe people the dignity and the self-respect that comes with being able to make decisions for themselves, even while they are dependent on the assistance of others.
At the press conference, Bevin was asked what would happen if the plan they're working on doesn't work for the state of Kentucky. He said if that was the case, the state would continue with the health care structure it currently has. In Frankfort, Victor Puente, WKYT.
Governor Bevin said they should know by the middle of next year if the plan they're working on will be able to replace the current structure they're using.